Hello, my name is Khristina Alma and I'm a respiratory care student at Dade College. Today I will be demonstrating a how-to video on incentive spirometry. At the end of this video, I will have discussed what is incentive spirometry, indications, contraindications, hazards, demonstration, as well as return demonstration. Incentive spirometry is a lung expansion technique that aids in preventing and treating atelectasis. Indications for incentive spirometry are patients who have had upper abdominal or thoracic surgery, abdominal or thoracic pain, presence of atelectasis, and restrictive lung defects are also indications of incentive. Contraindications. The contraindications for incentive spirometry are patients who have the inability to be instructed, patients who have lack of cooperation, and patients who have the inability to breathe deeply who have a vital capacity of less than 10 milliliters per kilogram. The hazards of incentive spirometry include hyperventilation, exacerbation of bronchospasm, hypoxemia, fatigue, pain in post-operative patients, and this can also be ineffective without correct technique. Before we get started, let me wash my hands and put on my gloves. So I'll go ahead and wash my hands for 15 seconds, and then I'll go ahead and don my gloves. The first thing that I'm going to do is verify the physician's order, and I will also identify my patient. Once I have identified my patient, I will also identify my patient's target volume for my incentive spirometry device by the patient's age and height. The target volume for my patient is between 2800 and 2950 based on her age and height. I want to make sure that my patient is sitting upright all the way, and I'll go ahead and assemble my equipment. This is the mouthpiece that goes on the end of the flex tubing. Okay, so as my patient will be inhaling, on inspiration, they want to keep a flow rate at a steady pace where it is at the happy face that you see here, at the blue arrow. And we want to keep it there. I will place this for my patient's target volume at between 2800 and 2950. And we want to try to set that as our patient's goal. So the way that this works is that we'll ask the patient to go ahead and exhale all the way out, and they'll then place their mouth around the mouthpiece, sealing it, and then they'll go ahead and inspire as deeply and slowly as they can, and then they'll try to keep the yellow indicator within the happy face area. So we're going to go ahead and ask my patient to hold this. And I'm going to go ahead and coach my patient. So go ahead and exhale all the way out. Place your mouth on the mouthpiece, sealing it. And then you're going to go ahead and take a deep breath in, slowly, keeping the yellow indicator at the happy face. Okay, so we didn't get a great patient effort this time. So we're going to go ahead and attempt this again. We're going to go ahead and set this a little lower. Go ahead, exhale all the way out. Place your mouth on the mouthpiece, sealing it. And inspire. You gotta try to keep it there. Almost there. Okay, so we got a better effort this time, and we're going to go ahead and repeat this steps for 6 to 10 breaths. We also want to let the patient know that they can do this on their own at the bedside, that you don't always need a respiratory therapist there to instruct the patient to do it. As long as proper technique is taught, the patient can do it on their own. I would then go ahead and assess my patient's vital signs. Checking the heart rate, respiratory rate, temperature, blood pressure, breath sounds. And then I will then record my findings. If there's anything else, I will let my patient know that I'm done. If there's anything else to make my patient feel comfortable, I'm fine. Good. So my patient is fine and comfortable, and I will then go ahead and take off my gloves, wash my hands, and we're all done.